But the thing that I found that was very challenging for me was watching in the outpatient when they were getting these invasive procedures like lumbar punctures, and they were being held down because they were very painful. And so I said, there has to be another way. So what I did, even at the clinic, which is still going on now, is I did relaxation techniques and preparing them for those difficult procedures. And so it was kind of getting a child to come in within a couple of minutes and saying, okay, what's your interest? Okay, what do you find that makes you feel good, happy? One little boy that I worked with, and I'm looking at your picture here of baseball, he loved playing baseball. And so I had him talk about imagining what it's like to be on a mound, throwing the ball, or where are you on the baseball environment,
on the field.
On the field, thank you. Okay, I'm looking at it there, but on the field. And so on the field, and he was picking up the bat, he could see the ball. I had him imagine what it would be for the ball to come. What did the day look like? The sun, all of that, the grass. How do you feel? And then during that time, I was showing him which parts of the procedure that were like feeling cold versus pain, and trying to show him those, having him feel it on his hands as he's talking. And so what we did was, okay, so I said, this is the story we're going to tell. So when you are in the room, I'm going to be looking at you and I'm going to be telling you this story, repeating this story. And I did this one time with this young boy. And when he had the bone marrow aspirate, it was like he was so connected. It was that when the bone marrow aspirate went in, the doctor jumped because he didn't jump.
Wow.
It was like it just went in, and it was just like the doctor, because he was expecting some tension. There was no tension. And so it was like I trained other child life specialists to be able to do this procedure. And so it's like, sometimes you say you have to have a long time to do things, to get people in. But if you can connect to them in the heart, there's something that they can then trust. And that's what I saw. And so that was kind of what I got out of that experience.
Yeah. So you didn't have too much formal training, and this was something that you really just started yourself and started implementing yourself. That's amazing. Because it's hard to get kids to really focus on, especially like meditative techniques and relaxation techniques. And it is definitely an art. That is incredible that you just took that initiative and started to do something like that, and it produced so much change.
And then it was something that with other kids too, and with the professionals, to see that I was saying it was a win-win for everybody. Because I could see the kids going in happy, and then everybody, the parents being wiped out, the physician, the nurse, the oncology, nurse team and doctors, they were all just tired. And I said, there's another way.